Hello guys, welcome back again to my YouTube channel. Welcome back to this video. Today I want to talk about anemia, because anemia is all over. Children, ladies, gentlemen usually suffer from anemia, and anemia can occur to anybody. It doesn't mean if you are a pregnant woman or somebody or a lady is when you are prone to anemia. Anemia can be a disease of anybody. So what is anemia? Anemia is a condition in which you don't have enough healthy red blood cells to carry adequate oxygen to your tissues. Having anemia may make you feel tired and weak. So there are many forms of anemia, each with its own cause, and loss of blood is the most common cause of anemia. Anemia can be temporary or long term, and it can range from mild to severe. Treatment of anemia may range from taking supplements to undergoing or medical procedures. You may be able to prevent some anemia by eating healthy diet. So these are the signs and symptoms. If you see, you are supposed to see your doctor, and if you see your relative with this sign, you should tell that person to go and see your doctor. The doctor. So the first one, if you have anemia of any type, you will feel fatigue. Because your tissues are lacking oxygen, or there is adequate oxygen supply to those tissues or tissues of your body, so you will feel fatigue, and weakness will set in. Anemia will cause paleness. Even if you are not learning, even if you don't have any knowledge in medical health or in health related cause, if you see someone who is pale on the palm, on the feet, on the toes, on the toes, and also on the tongue, this person might be having anemia. So tell this person to go and see the doctor. Anemia may present with regular heartbeat. So if you have regular heartbeat, you can always feel when your heart is beating. So you will get that you have a regular heartbeat, maybe high, maybe low, faster. If you are suffering from anemia, you can present with that one. Anemia will make you to have chest pain. If you're having a chest pain that you don't know the cause, or you're not suffering from any condition or any heart problem or any lung problem, or somebody has not treated you, then you might be suffering from anemia. So you can go and see the doctor. Anemia will cause dizziness. Anemia will cause dizziness because the brain lacks oxygen. And then what next? You will have dizziness, or you will present with dizziness. Anemia will cause cognitive problem. You are just tired of thinking. You just want to sit somewhere doing nothing, because even you're tired of thinking. You cannot reason clearly because you have anemia. Yes, anemia can cause problem of cognition, because the brain is lacking oxygen. How can brain work without oxygen? That is the point here. So it will cause cognitive problem. Anemia may present with, the person may have cold hands, cold feet, the skin is very cold. This is because the blood is not well supplied to these parts, to the lower, to the limbs, and to the skin. So you get this person is feeling cold at every time. Anemia will cause headache. If you are lacking oxygen in the brain, or if you have insufficient supply of oxygen in the brain, then you will have headache. You don't know even where this headache is coming from. Even if you take painkillers, it doesn't end. So those are the signs and symptoms that somebody who is having anemia will present with. So because I said anemia is lack of enough red blood cells, and then we have different types of anemia. We can have iron deficiency anemia, we can have vitamin deficiency anemia, we can have anemia caused by chronic diseases. Somebody who is having cancer, somebody who is having hypertension, somebody can suffer from anemia. Anemia, plastic anemia, is also a certain chronic illness that anemia associated with the bone marrow diseases. This is also a type of anemia. Hemolytic anemia, sickle cell anemia is also a type of anemia. I know you did not know that sickle cell anemia is also a type of anemia. We have several types of anemia, and I'm going to discuss one by one each of them that I have stated. So the first one that I'm going to start with is iron deficiency anemia. So iron deficiency anemia is caused by shortage of the element of iron in your body. Your bone marrow is the one that makes red blood cells, and your bone marrow needs iron to make an hemoglobin. So inadequate iron in your body can make your bone marrow not to produce enough red blood cells, and then you will suffer from iron deficiency anemia. So this type of anemia is often caused by loss of blood. If you bleed a lot, then you can have this iron deficiency anemia. So, or if you have heavy menstrual period, you can suffer from this type of anemia. Cancer, polyps anywhere, you can have this type of anemia. So the next thing that I'm going to talk about is vitamin deficiency anemia. There are some anemias that are caused by some insufficient vitamin in your body, in addition to iron, I mean. So your body needs folate and vitamin B12, to produce sufficient number of healthy red blood cells. A diet lacking this vitamin can cause you or can make you suffer from vitamin deficiency anemia. So additional, some people may eat vitamin B12, but their body are not able to produce the vitamin. So this can lead to deficiency of this type of anemia, and this type of anemia is also called pernicious anemia, lack of vitamin B12 in your body, because vitamin B12 also help in the absorption of food. So you get that if you don't have this vitamin B12, you might suffer from anemia. We have another type of anemia that is caused by chronic illness. If you have HIV, arthritis, if you have cancers, these types of chronic illness can make you suffer from anemia, because you know that they need a lot. You need a lot of blood for you to fight against these diseases. So if you are having this type of diseases, they can also predispose you to anemia. We also have plastic anemia, whereby bone marrow doesn't produce enough red blood cells, and when your bone marrow doesn't produce enough red blood cells, you will suffer from anemia, because your bone marrow doesn't produce enough red blood cells. Where will your body get hemoglobin, or where will your body get red blood as a whole? So if you have a condition that interfere with the production of red blood cells in the bone marrow, then you will suffer from anemia. We also have hemolytic anemia, whereby red blood cells are being destroyed rapidly, more than how the bone marrow produce the red blood cells. So they cannot be replaced quickly as the red bone marrow produce the red blood cells. So you will have to suffer from anemia. So the last one we have sickle cell anemia is sometimes inherited, whereby your red blood cells assume sickle shaped, and you get that they assume sickle shaped, and then your red blood cells will suffer from inadequate oxygen, and then pain will set in. And these sickle shaped red blood cells usually die prematurely, and you get that you suffer from shortage of blood, and whereby you will have to suffer from anemia or sickle cell related anemia. So who is at risk of suffering from anemia? A pregnant mother, because they are 2 or they are 3 and they need a lot of blood for the baby to survive. So you get that a pregnant mother is at risk of suffering from any type of anemia. That is why they are being given iron folic acid to boost the blood. And also a woman who is menstruating is also at risk of suffering from anemia, because of every month menstruation or every month losing some amount of blood. People who have some chronic illness can suffer from anemia, and also family history. If you have a family history who they usually suffer from anemia, you can have anemia, like sickle cell anemia. Also, if you don't eat a balanced diet, you can suffer from anemia. You will lack iron in the what? If you are eating a diet that doesn't have a balanced diet that does not have iron, then that does not have vitamin B12, then you will suffer from anemia. So what are the complications that someone who is suffering from anemia can develop? The first one, you can suffer from the severe fatigue. You are always tired. You can't do anything, and you can't do anything, that is dangerous. You will not be able to take care of yourself. You will not be able to take care of even other people. So it is a complication. Yes, it is a complication. You will suffer from heart problem, because your heart need blood. Your heart need blood for it to supply the other organs. So you will suffer from heart problem, and in relation to that, you will also suffer from other organ problem. You can suffer from kidney failure, brain failure or brain diseases. You can suffer from lung problem. You can suffer from a lot of you can really have organ failure, multiple organ failure, because of lack of anemia. That is how dangerous lack of blood is, or that is how dangerous anemia can be. And also anemia can cause death. Yes, somebody can die because of lack of blood or lack of enough blood. So those are some of the complications that can set in if you are suffering from any type of anemia. And what can you do when you have any of this type of anemia? If you are suffering from iron deficiency anemia, you will be given supplements. They are available and they will boost your blood. If you are suffering from vitamin deficiency anemia, you will be given those supplements. If you have any chronic illness that is bringing the anemia, then the chronic condition should be treated so that it can correct the type of anemia that you have. If you have aplastic anemia, then you can be done for bone marrow transplant, where it is very expensive, but it is possible. I don't know if it is successful. It can be successful, but it is in the books, so who am I not to say it? Sickle cell anemia, you can be transfused with blood. And also the doctor will manage the signs and symptoms, because it's usually present with a lot of pain in the lower limbs and lack of oxygen. So the doctor will manage the signs and symptoms of sickle cell and transfusion, and maybe you're given the prophylaxis for infection because you are prone to infection. And in general, anemia can make someone to be okay. You can be transfused, or you can get blood transfusion if you're suffering from any type of anemia. And also, diet is very important, because if you are suffering from vitamin deficiency, you can be guided on how you should take your diet so that you get the supplement on the food. So I think those are some of the how anemia can be managed: both the diet, the iron supplement, the vitamin supplement, transfusion, and the management of the signs and symptoms that present when somebody has sickle cell anemia. I think I've exhausted everything, so thank you for watching, and let's meet in my next video.